risk factor for suicide, mnemonic is big sad. B for borderline personality disorder. Borderline. Borderline, multiple line. Yes, patient cut himself or herself again and again. Yes, borderline personality disorder. S for schizophrenia. You all know schizophrenia most common cause of death is suicide. Prevalence is around 10%. Question was asked. But according to DSM-5, it was around 5 to 6%. But question has been asked, the prevalence of suicide in schizophrenia is around 10%. A for antisocial personality disorder. Antisocial personality disorder. A for alcohol. D for depression. You can't forget. Yes, depression is most common cause of suicide. Question is asked, most common cause of suicide. Depression. We were struggling. Why these patients commit suicide? Yes, a concept came, psychological autopsy. So many points are there. One point is the patient who committed suicide. We found that in their CSF on autopsy, in their CSF, 5-HIAA level was low. 5-HIAA level was low. Yes, you know 5-hydroxyindole acetic acid is metabolite of serotonin. Metabolite of serotonin. I deliberately correlate depression, there is decreased serotonin. If decreased serotonin, their metabolite will decrease, 5-HIAA will decrease in CSF. Question has been asked. Most common method of suicide after so much of advancement, even now hanging more than poisoning. This is controversial, but according to recent data suggest hanging after so much of advancement. I took example, if you remember, patient want to commit suicide in paradoxical suicide, but he's not having energy, will not go to market. Who will go to market? Who will buy rope? Who will hang? Hang. Okay, hanging is most common, you will remember. What is parasuicide or DSH, deliberate self-harm, or non-suicidal self-injury? Yes, means patient don't want to commit suicide. There is no intent to commit suicide, but will do deliberate self-harm. He will or she will harm himself or herself. Yes, the intention is not to commit suicide. So, name is non-suicidal self-injury. Okay, or deliberate self-harm or parasuicide. This is the name given by DSM-5. Question can be asked. So if patient is having non-suicidal self-injury, what you will do? You will ignore him? No, it is cry for help. What I said, cry for help. Many times we found that these patients want to conveys the message that I am really disturbed, please help me, I am showing you that I can commit suicide. Initially they are cutting, yes, superficially, but if you will not give attention, yes, they may commit suicide. So never ever take deliberate self-harm lightly. Got the point? Cry for help slogan. Question may be asked. Copycat suicide usually seen in adolescent. They try to copy celebrity, their peer group. I do remember there was a series Netflix 13 Reasons Why, in which the girl committed suicide and said that why I committed suicide. After that suicide rate increased. Means they copy. Why they copy? Because their cognition is not so mature in adolescents, children. That's why they do copy other peer group or celebrities. That is copycat suicide. Question was asked, commonly seen in adolescents. Now, before discharging, how we will assess the suicide risk? There is a scale that is called sad person scale. Yes, name itself tells you the mnemonic. S for sex. We found that male person has increased chance of complete suicide. Female, more attempt suicide. I again repeat, male complete suicide, female attempt suicide. But in medico female have more suicide rate, complete suicide rate. Okay, unfortunately. Question, recently asked question. Now, A for age less than 19 or more than 45. Increased chance of suicide. I told you in less than 19, cognition is not so mature. Okay, but if one to choose, yes, old age. Yes, old age is more important than adolescent. D for depression, hopelessness, depression, hopelessness, risk factor. P for previous suicide attempt, previous suicide attempt, or psychiatric illness, psychiatric illness. If a patient is having psychiatric illness, I told you mnemonic, big sad, borderline personality, schizophrenia, alcohol, antisocial personality, depression, so there is increased chance of, yes, suicide. I'm skipping the main discussion and pointing out this hopelessness. Hopelessness is very important for suicide. Yes, I told you in cognitive triad, Beck's given by Aaron Beck, that if hopelessness is there, there is increased chance of suicide. A question was asked, they gave symptoms of depression. They gave symptoms of depression and they mentioned there is hopelessness. If hopelessness is there, it means that rate of suicide is increased, the chances of suicide is there, better to admit the patient. And yes, you will manage patient according to suicidal risk. Now, E for excessive alcohol, excessive alcohol. R for rational thinking lost, rational thinking lost. Actually, this is not my own mnemonic. This is scale. And R is written like this. Rational thinking is lost. If rational thinking is lost, definitely patient may commit suicide. Excessive alcohol, patient may commit suicide. Psychiatric illness, patient may commit suicide. Previous suicide attempt. If question is asked, what is the most important predictor for further suicide? I would say previous suicide attempt. If previous planned suicide attempt is there are chances that patient will commit suicide again. Okay. Now, S for separated, divorced, organized attempt. I told you, if previous attempt and it is well organized, this is very important predictor for further suicide. No social support, no social support. And S for stated future intent. Sometimes patient would say, Dr. Saab, I will commit suicide. I know this time I am saved. Next time I will definitely commit suicide. So these are common risk factor for suicide. And sad person scale, we do assess, and according to the score, we decide the patient is on high risk or low risk. And if patient is on high risk, we don't discharge, we keep the patient admitted. Thank you.